When there is a shared experience between patient and physician or provider, we know that patient outcomes are improved. And so it's really important to diversify the workforce. And equally importantly, the physician workforce should resemble the population that it serves.
Dr. Amber Brooks is an anesthesiologist and pain medicine physician at Wake Forest Baptist Health, where she says she's been cultivated, mentored, and supported. She helps lead Baptist's effort to recruit a more diverse physician workforce.
I would say that if your institution has the reputation of being one that cultivates a nurturing environment, one in which people feel like they're included, one in which their voices can be heard. If your institution has that type of reputation, then people will come. In order to create an inclusive environment in which everybody feels welcomed, one of the first things that you have to do is you have to educate people about the benefits of being diverse and inclusive.
To do that, Baptist had the Year of Inclusion 2 years ago. Dr. Brooks says that sparked conversation and initiatives that continue today.
So I've had difficult conversation with non-minority colleagues or white colleagues, but it's also been a time for them to, I've seen hearts changed. It has led to an opportunity for people to be in a space in which they are more receptive to hearing about those historical atrocities.
Like the Tuskegee experiment. In 1932, doctors with the U.S. Public Health Service recruited 600 black men for an experiment with the promise of free health care. 399 of them had syphilis. There was no known treatment at the time. They were all told they were being treated for, quote, bad blood and given placebos, even after penicillin was discovered to treat the disease. Researchers did not provide effective care, even as the men experienced severe health problems related to their untreated syphilis, and some died. Tuskegee is one of the top reasons black people who don't trust the healthcare system or the vaccine cite, including Dr. Brooks' grandmother, who lives near Tuskegee.
Their concerns are that it's experimental. The government doesn't care about Black and brown people. I have to acknowledge those hurts. I have to acknowledge those atrocities. Those are real for some people. And then hit them with data, facts, and lead by example.
As hearts and minds open and the doctors who serve the community look more like the community,
I think that no matter where you are on the spectrum of your interest or your experience with diversity and inclusion, we can all agree in healthcare that ultimately we want to deliver safe, quality healthcare to our patients. That's what it's all about.
in black and white, Tracy Clemens, Fox 8 News.